Well, and we know that especially for a day like this, we have to make sure that we also give back to society, and what a way to do all this. We have the Joy medical team of the ICGC. They're here, and they are undertaking a great initiative to ensure that they give back to society and making sure that they do screening. They also undertake a lot of need for the public who will also need medical care. And I have the team members here with us. I have the president of the Joy Medical Team, ICGC, and Yao Asare is here. Good morning to you, Yao.
Good morning.
And then also Samuel Ohiming is a certified registered anesthetist with the Kolebu Teaching Hospital. Good morning to you.
Good morning.
Yeah, I know. You're always involved in theater, right?
Exactly.
Exactly. Charlie Udipos. And then Prince Adevu Kwame.
Yes.
You're a medical doctor.
Yes,
Charlie, so calm. Charlie, medicine is hard, but Charlie be big man. And you're currently with the
Upman Clinic.
Upman Clinic,
yeah,
La Paz.
Yes.
Very good. And thanks for joining us.
Thank you.
But let me start with you as president. The whole initiative is essentially what?
The whole initiative is essentially about giving back to society. As a church, we also have a social responsibility to give back to society. And we started this program for about 7 years now. This is the 7th annual outreach that we are doing. And we know in the constituency that we are in and the assembly that we find ourselves, we check their data and realize that there are a lot of prevalences of diseases over there, malaria for instance. So we as a team and as a church came together to make sure that we're able to organize this program for the community, and to help us to also win people to Christ and also give back to society.
Yeah, I love that line, to enable us win people to Christ. But that'll be the Joy Temple?
Yes,
yes,
Joy Temple.
Where is it located?
It's located at Ashalbotre, Agowi Junction.
But in putting this together, it means that you mainly get the resource or the human resource from the church. Is that it?
Yes, we get the human resource not only from the church, but a couple of people from the church, both medical and non-medical as well. We also have other people that are coming from the other hospitals, Kolebu, and various facilities across.
So basically meaning that not only members of the church, but maybe professionals within the church who know others, they can pool. So it's more like pooling more resources.
All specialists of various units coming around just to help with the outreach.
But Sami, what really is the target? Is it only confined to a certain community, or you invite everybody else?
Oh, that's the more reason why we are here. We're inviting the whole of Accra, and if possible, Ghana, because we've had people from all over Ghana for the past years coming for various screenings and various tests just to know their status. So it's not for the people at Ashalbotre or Adenta, but the entire Accra and Ghana as a whole.
But at the end of the day, you know, we're around, we don't do the screenings and all that. But why would you say that it is important for us to regularly be checking our health?
Well, as a medical officer, I speak for health most of the time. Our health should be of primary concern to every Ghanaian. And we have a lot of diseases that are going on that are unchecked in our communities. If you go through our data, the assemblies, you come across that various diseases that can easily be prevented, certain things that can just need some minimal input to improve our lifestyle can be done, are not being done. So if we have such an opportunity to educate, because we don't just screen, we also educate people as well, so that they get to know about their health and take better decisions that will affect them in the long run.
And yeah, if we want to posit this within the context of the church contributing to the society, it also means that it has to be complementary. The society should be willing to come to the church to say these are some of the needs that are needed. How can we best collaborate with that? How do you go beyond what you do within your confines as a church, but to affect your community by perhaps going to the people instead of also waiting for them to come?
Yeah, that's why we've taken this initiative to get in touch with multimedia to give us a platform to be able to talk to people, to be part of this program. We also have an information van going around in the community, also announcing to the people that this program is coming on this very Saturday. So these are some of the initiatives we've taken to make sure that we have the people coming to patronize this program. we want people to come and patronize this program. So that is the reason why we have this airtime to be able to do this.
So what's the venue for the main screening?
Yes, it's happening at Joy Temple ICGC. It's located at Ashaliboche.
When?
Tomorrow. We're starting exactly at 7 a.m. till we see the last person. And you should know that it is free. It is absolutely free. We are not taking anything from anybody. As you can see on the screen, we are doing a lot of things. This is dental screening. This is the period of registration. We are even registering for national insurance. I mean the
National Health Insurance.
National Health Insurance, yes.
Wow.
And then you just come. Just if you are a government worker, just get your SNP number and just come around. Come with your children, the old men and the old women. Come, let's see check your eyes, because know that there are specialists coming. Specialists from different angles. We have the obstetricians and the gynecologists. We have the dental unit. We have people coming from the ophthalmic unit. We have the ENT nurses will be there. And in fact, the most basic things that we ought to do is the basic vital signs, because as we said earlier on, if you are not able to check your blood pressure regularly, you wouldn't be able to know whether you are diabetic or not. And we as medical officers, we know that something like hypertension is a silent killer. You wouldn't know when it's going to put you down. It will just, yes, we hear of people dying in their cars and all that, just because their BP went up so much that they couldn't do anything and they just popped off. Yes, it just went off.
Okay, so what's your last word to the public, especially when we know that the event is tomorrow, from the Joy Temple team?
Thank you. I think I'll use the platform to invite everyone once again. Come and let's just do the basic things concerning your health. And let's know your BP, let's know your sugar levels, let's know, sometimes we add that test as well. Just get to know them. And also come for information that will help you make better choices in your health.
Will you do HIV test there?
Certainly.
Yes. Certainly. Okay. Certainly. Okay. I'll come back so that we'll have more.
Certainly.
Right.
On that note, I think everyone should know their HIV status in Ghana.
Very well. Very well. I think it's very important as well. But thank you very much for passing through. The president of the Joy Temple Medical Team, ICGC, they are based in Ashaliboche.
Yes.
It's right?
Yes.
And that's Yao Osai has been here with us. Samuel Ohiming is a certified registered anesthetist with the Kolebu Teaching Hospital. And then also we've had Dr. Prince Kwame Adevu.
Yes, please.
That's the right pronunciation.
Yes, you've got it right.
He's a medical officer at the Opman Clinic. It's based in La Paz, here in Accra. But